A warm welcome back for the second part of this year's Global Health Talk of the Global Health Hub Germany, and a warm welcome to everyone who just joined us for the afternoon session. My name is Maike Voss, and I'm the Managing Director of a yet-to-be-established new think tank on planetary health and the German Allianz on Climate Change and Health. As most of you know, the Global Health Hub Germany is a network of almost 1,500 members that aims to bring together all actors interested in global health here in Germany. The hub wants to promote exchange, initiate new partnerships, support cooperation, and innovate approaches across sectors and stakeholder groups. One way of achieving these goals is by organizing the Global Health Talk we have today. It is a yearly conference bringing together members and interested parties from different sectors and disciplines to discuss current global health challenges and potential solutions. Today, we discuss the greatest challenge in the century, as the Lancet has stated, the climate crisis and its impact on health. This year's Lancet Countdown on Climate Change and Health, its policy brief for Germany, and also the results of the IPCC and the recent COP show that more has to be done to tackle the implications of climate change. That's why we have the discussion, or the afternoon discussions today, under the title Red Flag, Climate Change and Health, Next Steps for Germany. I think the day today that the coalition is coming together is a good sign for, and a good sign for this discussion. Let me start with a little bit of housekeeping. To participate, you can use you can post questions to the panelists that I will pick up, and you can use the Slido chat you have maybe used in the morning as well. And the questions will then come and stream to me, and you can also see the questions there. You maybe have to open Slido in a new tab because some companies don't or disable the tool. So maybe just refresh Slido or just use another tab. We don't want to waste any time because we have a full program. So I'm very, very happy to welcome our keynote speaker, Antonella Risso, who is with us from Patagonia. Let me just quickly introduce you, Antonella. You were a technical project coordinator for more than 8 years, and you helped the global green and healthy hospital network to get as vibrant as it is today. You worked for Argentina's Ministry of Health and especially on sustainability issues, and now you lead Healthcare Without Harm's work to support hospitals and health systems to measure, track, and reduce their climate footprint. Based on your experience in building a network for a CO2 reduction in the healthcare sector, you will give us some insights into the drivers and barriers of the topic, also considering different starting points across the world. So we not only hear about Germany, but also other countries. Most importantly, Antonella will be able to present the audience with the best practice example in form of pioneers in the world. And I'm very happy to have you, and I look forward to your keynote.
Thanks, Maike, and thanks everyone for the invitation today. So I think we should see my slides now, right? But because I don't see them. Should I see them? Okay, I see here.
They are up, you can start.
Yeah, but it's really, really small. Is there a way that I can see them, or should I open them elsewhere? Sorry for this.
No problem.
I think it's better now. Okay, I just see them better. Okay, so thank you. And as Maike said, I live in Argentina, I live in Patagonia, but I work globally. I have been doing that for a few years. So thanks for the invitation today. So red flag, let's go to first slide. Just to tell you, because maybe some of you don't know what Healthcare Without Harm is, it's an organization that has 25 years now. This year, we work globally, almost everywhere. And this is an organization that has offices in different places of the world and a global secretariat that's where I work at. I work for the climate team at the Global Secretariat and worked before for Latin America, as you see. And we have partners in India, partners in South Africa, there's an office in Europe that is in Brussels. There's an office in the United States. There's a team working in Latin America. There's an office in the Philippines for Southeast Asia. partners in India, partners in Australia. So just for you to know how this complex organization is organized. So next slide, please. As the title said, red flag. So I just if some of you do not read IPCC reports, but probably all of you know what IPCC is. And if you don't, well, that's the scientific word that UNFCCC, the climate organization of the United Nations, has to give advice to countries. So the latest report was launched in August, developed by 260, I think, researchers from 60 countries. And what they said was pretty bad for all of us working on climate. One of the things that they said is that the scale of the changes as a whole are unprecedented in many ways, and they're going to stay here for centuries and many thousands of years. So that was one thing. Part of the impacts of climate change are already here, and they're not going anywhere, whatever we do. So that's important. And they are across the world. So there's no country that could say today that they don't have any problems with climate change. Let's go to the next one, please. Other thing that they said is that it's very likely that Paris Agreement's goals are not going to be achieved because the global surface temperature has already increased, and the global warming 1.5 goal that we have in the Paris Agreement is pretty likely going to be achieved in the next few decades, and the 2 degrees could be exceeded during this century. So that's very, very bad. But they also say that if we do what we have to do, we can really slow this impact and to stop it from being even worse. And many of as related to the one before, many other thing that they said is that many of the changes due to past and future greenhouse gases, because I don't know if you know this, but many of the gases stay for decades, centuries in the atmosphere. So once we release them, they are already there. And even though some are trying to capture them, that's really not something that is going to work like at a massive scale that we wouldn't need that. So many of the changes due to this release of greenhouse gases that we're doing are considered irreversible. So that's what the IPCC said just in August, and that's the red flag that the UN is saying. So another red flag, I don't know if you know the Lancet Countdown reports on climate and health. I think they're really good, and well, probably the best if you see global reports. And they have a data platform that was developed by an Argentinian, so I need to say that, and a female one, Marina Romanello. And so they have this amazing data platform for us to analyze the data. And one of the you can see easily, like for example, land affected by drought. And you can see that if you see that graphic, it starts on 1950. So this is not centuries back. It's just at least 70 years back. And you see how that curve is going up just in 70 years. This is not hundreds of years. And this has impacts on migration, on access to food, access to water, health. This has many impacts, of course, in the economies. So I recommend you to see this because this is part of the red flags. We are seeing impacts on climate change, on migration, on economics, gender, whatever you want today in many places of the world. So not in the future. Next, please. And I'm here with a red flag plus the opportunities for health as a sector. And this year, in April, we launched a Healthcare Without Harm. We launched a roadmap for the healthcare sector for climate mitigation and a different model of care too. So what does the roadmap came up with is we developed this with Arab, in case you know Arab, is that if the healthcare sector is like business as usual, emissions of the sector would triple by 2050. So we really need to change. Business as usual for the sector is triple emissions by 2050. And we need to go to zero in many countries in 2050. So there's a lot to change here. But it is possible. So we have modeled different types of interventions and different, we're going to see that, like for different countries, different types of curves for 2050. So the bad thing, business as usual, 2050 we will triple. But let's go to the next one. Another thing here is how these emissions are distributed around the world. And this is similar to what we see with countries, but a bit different. Because as we see today, like global emissions, well, some say China is the biggest, right? Not historically, but now. But if we see healthcare, it's quite different. The United States is 27, China is 17. And this is related with developing countries because in many countries, the healthcare sector needs to grow and a lot. We need a lot more healthcare. We need a lot more care. But how that growth is going to happen is something that we need to work on, all of us. And the European Union here is 12. It's for this report, it's like of global emissions of the healthcare sector. And the sources are there. The links are there for anyone to see later. So next one, please. And we have developed in this roadmap fact sheets for 68 countries. One is Germany. So you have the link there to see the one from Germany. And of course, it's there in green highlighted. Germany is assigned in a roadmap for a steep decline in emissions because, of course, it's a rich country. So all the rich countries in our roadmap need to go deep down in emissions as soon as possible to give time to the other countries because they are going to go slower, of course, slower. So Germany is selected for in these common but differentiated responsibilities that we know and different capabilities too. Germany is selected for the steep decline here. So next, please. And one thing that I know Sophie was earlier today. One good thing that is happening is that there's a climate and health movement like being built around the world and it's getting really active. And in Glasgow, just a few weeks ago, we presented a letter signed by 46 million health professionals demanding climate action. This is getting bigger and bigger. And part of the thing of what that letter says is that call on high-income countries to make larger cuts, larger, faster, further, to greenhouse emissions in line with the 1.5 goal, because we know that we have already enough impact with less than that. Next, please. Other thing that this letter says, it calls on governments to be climate resilient, low carbon, and sustainable health system. And we work on that during the last COP in Glasgow. And of course, high-income countries need to provide the promised transfer of funds. You know, probably if you follow the climate negotiations and the climate talks, you know this is an issue that the richer countries committed to provide 100 billion a year for mitigation and adaptation, and that did not happen until today. So that's part of the call of the healthcare sector too. And I have also put there in the slides, because we didn't have time, we presented at COP with the Climate and Health Alliance, GHHG. There's a very nice video developed by healthcare workers with this this prescription that they're asking for climate and health. So next one, please. And in the opportunities too, some things that are happening for you to know. We are working at Healthcare Without Harm in a campaign with the Climate Change Champions. You maybe don't know what this is, but it's the non-state actors, because in UNFCCC, in the climate negotiation, in the Paris Agreement, like the parties are countries. There are many others in the climate work, like non-state actors, they say. So not a national country, but a state or by a company. Others that are not the national governments are part of this through some initiatives like Race to Zero. And the climate champions are people just that they name for each COP that lead the work with the non-national parties, not parties, but you could say stakeholders. And in the Race to Zero campaign that was launched this year, there's a list there of the ones for Germany that already signed and have already committed to go to zero. And that is interesting because Germany as a country has not committed the healthcare sector yet to go to 0 to 2050. But there are German institutions that have already assumed this commitment. So that, I think that's interesting, and that was good for you to know this. And the other thing that we presented recently is the COP26 health program that was signed by 51 countries. 14 of them signed the net zero commitment. And what was really interesting for us to see that the first ones that signed it, the first signatures that were coming, were all from very vulnerable countries, like Malawi, like Kenya, like Fiji, like Saint Tome, like very vulnerable countries to climate change were the first one to really take the call and sign. And after that, Spain was the first developed country, and now others are, like Belgium signed the net zero commitment, and 46 signed the sustainable and low carbon healthcare systems. Germany did sign this one. They just did not sign the net zero commitment for the health sector. And 50 signed the climate resilience systems. So 51 total, and the list is there. The links are there for you to see all of this. Next, please. So next steps for Germany and opportunities. I think there are many. One is leadership, clearly, for the country, that the country signed the COP26 commitment. It would be very good to review and see if the country could sign the net zero commitment to 2050 and start developing the roadmap. This is not easy. We notice that there's no country that can do this alone. Even the NHS is saying that with their huge healthcare system. They're saying we cannot get to zero alone. You need the suppliers and you need other systems in the world to go in the same direction so we can do this, because there's a lot of innovation here. For example, I don't know if you saw, like during COP, the NHS is testing the first no emissions ambulance. There's a hybrid with hydrogen and electricity. And that was like the NHS made it possible. Like 2 years ago, they started with an innovation fund and started to promote innovation within the sector. And that ambulance is not a reality because there's a sector, healthcare sector, asking for that. So we need a lot more of that, because we need not only to put solar panels that we need to, and we need to work on energy efficiency, but we need to work on the supply chain of the sector. That is very, very complex. And we learned the hard way during the pandemic how hard that supply chain was. Really, and for many of our countries in the south, that was a really complicated thing, really. So we need to solve that. We have climate change now in the middle with many other difficulties that we have. So leadership, I think, is a very good opportunity for Germany to work in networks, to join this movement, and really to work with all of us. Probably many of you are already doing it. So, but as a country, nationally, and European Union, really to join this. So track your emissions, include the supply chain. That's very important to include the supply chain when you start tracking emissions, and set the roadmap to 2050. So I think that's my main message. And there's a lot of, we work with many countries, so we're going to talk about later about that. So I hope I'm on time, because this is it. And thank you. This what I have a last slide. Last slide, please. Just, you have my email there. It's Antonella, my name, and healthcare without harm, like the acronym, .org. So gracias. And please, do you have any questions? Thank you.
Gracias, Antonella. Thank you very much for this very insightful presentation, and also your experiences with COP and what you learned and heard there. Thank you very much. We are very, very happy that you can stay with us also for the panel discussions. So I would switch all the questions you get from the audience to the panel discussion. And to the audience, please send in your questions via Slido. And I will then pick up the questions for Antonella and the other panelists. I will now introduce to you the other panelists for the panel discussion. The aim of the panel discussion is to look at the status quo of what is being discussing and the measures here in Germany in place in climate change and health, looking at the domestic level, but also on global health policy making, of course. And also, more importantly, we want to discuss what needs to be done, where, how, and how fast. Because of course we don't have any time to waste when it comes to climate crisis. We will use the very concrete statements I will get from the panelists to then feed into the next discussion with policymakers as the second part of the discussion. So these two discussions are linked, and I will try to make sure that we use the results of the first discussion in the second one. So I will now introduce my panelists. First one is Sylvia Hartmann. She's a physician and vice chairwoman and project coordinator at the German Allianz for Global Health and for Climate Change and Health, I'm sorry. So Sylvia and I, we are colleagues, I have to say that first. We also have with us Philipp Wiesemann, who's a political scientist and project manager for climate change at Mercator Foundation. I'm sure maybe, Philipp, you can say a little bit more on Mercator Foundation, but Mercator Foundation aims at including the topic of climate protection as a cross-sectoral task for the health sector. And you have years of experience in project work on climate change. And we have with us Professor Dr. Claudia Traidl-Hoffmann, professor for environmental medicine at the Faculty of Medicine at University of Augsburg. And you are also deputy director for the Center for Climate Resilience at the University of Augsburg. And I am sure you have many, many more hats on your hat. So I maybe just leave it there. And maybe, Sylvia, we can start with you with the first question to start off. From your experience, what do you think are the biggest challenges and health risks in the concept of the climate crisis that we need to tackle very fast?
Yeah, thank you very much, Maike. And as you mentioned before, it depends on which perspective you're looking at. So first of all, I would like to say that I'm really happy that we're talking here about it. We should have done that already 10 years before, when the Lancet was announcing that climate change is the biggest global health risk of the 21st century, but I'm happy that we're doing it finally now. So why do we need to talk about it? Because we're putting at risk the health achievements, the global health achievements of the last decades. And I just shortly touch on what we're going to expect. So we're talking here about more extreme weather events like flooding, storms, or droughts. We're talking about more heat waves, of course, rising temperature. We're talking about land degradation, water shortage, and also all these health effects that are then caused by that, like malnutrition, injuries, cardiovascular diseases, and also of course, conflict and migration that are caused due to, for example, malnutrition or droughts that destroy harvests. So that's the global level. And then we can also have a look on the more national level, where in Germany we have to expect as well more heat waves. There just has been a recent study that it's expected that children that are born today expect 7 times more heat waves than people nowadays. So that's kind of the number. And that what we see now is just a really tiny glimpse of what we're going to expect. So the worst is still to come, I have to say, if we just don't act really today and now and really act urgently. And it's also what I would like to add, it's not only about the climate crisis, we have further crises like biodiversity crisis, the geochemical flows that are disrupted, and also the pollution. So all this crossing of the boundaries that our current lifestyle is causing, yeah, we have to be aware of all these others as well. And yeah, that just as a short glimpse.
Thank you very much, Sylvia. So a lot needs to be done and fast. Thank you for setting the scene for what we have to tackle and discuss. Philipp, let me continue with you. I know that the Mercator Foundation recently shifted its work to support the intersection of climate change and health more greatly. I think usually before that you looked more on climate change, and now you look at the intersection. What led to this strategic change, and what are you aiming for, in particular looking at the landscape of actors in these two fields here in Germany?
Yes, thank you, Maike, for the question, and thank you for the invitation. Yeah, as you said, Mercator works on greenhouse gas neutrality in Germany, so we are a classical climate funder and have no initial link to healthcare or health work. So we largely focused in the past on the climate-friendly transition of the sector's energy, transport, industry, by providing best available knowledge to policymakers, by enabling stakeholder dialogue and supporting fact-based public support. But of course, as a foundation, we have to closely observe the landscape and the developments in society and politics, and then, of course, regularly have to assess whether we need to adapt our strategical approach. And of course, it's no surprise, as we heard from Antonella, and as we know, that Germany and every nation worldwide is far away from what is necessary with regard to climate, even far away from political commitments that already exist. And from my perspective, one reason, at least, is that it is not, at the moment, not politically risky to fail on climate. The broader electorate, of course, is somehow in favor of climate action, but does not really demand ambitious climate action in the way that is necessary. So this is very much, from my perspective, since climate change is mostly discussed and treated as an environmental issue with risks that lay way in the future. But instead, of course, climate change is a societal cross-cutting challenge, and climate change, unabated, will severely impact every aspect of human life, especially health. So at Mercator, we decided to expand, not to change completely, but to expand our strategy, and try to firmly anchor climate change as a cross-cutting challenge. We choose the health sector, among others, but as a priority for our works for mainly two reasons. One is that if the health sector integrates climate change as a core principle and communicates health arguments for climate action, this may strengthen the societal support for climate action and put pressure also on politics. And the second reason is, as we heard also from Antonella, that the decarbonization of the health sector leads to scaling effects in related industrial sectors and supply chains. And therefore, this is the main reason why we said, well, we have to now expand our work and really look at these interlinkages between climate and health. And as far as we observe the field, there is no real community existing at this nexus of climate change and health. We have either the climate funders, climate NGOs, climate politics, and on the other side, health foundations, health NGOs, health institutions, and we really need to strengthen this nexus. And as a funder, as a foundation, Mercator can play a role with this.
Thank you very much, Philip. I'm just reminded of the discussions health people have, how to bring health in other policy fields with using concepts like health in all policies, and what you would just have been saying is climate in all policy. So maybe we can link these two concepts and then look at the intersection. Very interesting. Thank you very much. Claudia, I now come to you. I know that you just have edited and launched a new book. Maybe you can also tell us a little bit about that on planetary health. Thank you. Oh, other way around. Yes, thank you. And maybe you can share with us your thoughts on the status quo. Where are we right now in Germany, looking at the German health system, but also maybe looking at Germany's global health policy making when it comes to climate change and health?
Yeah, thank you. First of all, thank you for having me here today. It's really an honor and pleasure to speak. And I think we have to make us clear that we in the health system we have three tasks. Firstly, we have to help people to adapt to climate change, because climate change is obvious and is here, and hopefully we will mitigate climate change, but we have to adapt to the climate change which is already here in Germany. And we know that this climate change is making Earth thick, and thus also the people who depend on this, and also here in Europe. Secondly, as one of the largest producers of CO2, the health sector must take on the task of making sustainability part of the health sector. So sustainability is really important and has to be a real focus. And the third task is just as important as the others. This is to take the responsibility to bring this narrative forward, the narrative that climate change is the greatest risk and greatest threat for our health and humanity in general. And taking these three tasks into account, we really have to go stepwise in taking all these three tasks in our daily schedule, let's say. So the first task to adapt, we have to have plans, heat plans, which are not currently in our system in Germany. So we have really to adapt to heat and have really SOPs, what happens when we have heat here in Germany and in Europe. So here we really have to work a lot. Secondly, for the second part, that we have to implement sustainability in our healthcare system. I think we started now. We brought the things on track, but the train is only running slowly at the moment. So we have really to take and pick up even more speed here in sustainability in the healthcare system. But the first steps are done, and I'm quite proud that Germany now is awake, let's say, in the healthcare system. And the second and the third thing is to bring this narrative forward. Also here, I think we are on a good path. Every day we get more medical doctors that fight with us and say that climate change is a threat for our health, but we need more. And but I think when we take these three tasks as our daily schedule in the health sector, we will make a change really, and we can then tackle this great and huge threat we have for our health and for our humanity.
Thank you very much, Claudia. And I think this is true and can be streamlined in domestic health policy making, but also in global health policy making. Thank you very much. Antonella, I got a very good question that maybe fits to your presentation and to your work from the audience on Slido. I will just read it for you. Not many hospitals are interested in changing anything for climate aspects. The hospitals won't not like to pay for this. How could this be changed?
Well, I think that it depends of if you are aware of what climate change actually means for you. I think that's probably not true once you are aware. It's like when we all learned that mercury was toxic. That's a tipping point. Once that you know, it's really hard just to forget about it and to keep walking. I think once that you know the impacts that it has on your communities today, the impact that it will have later, how impossible it's going to be to achieve zero poverty or even universal health coverage around the world if we don't tackle climate change. It kind of like, how come that you are not going to work on this? If climate change, as Sylvia was saying at the beginning, is actually going to stop probably your plans of getting better and better or having a universal and effective health coverage around the world. It's just impossible. I think many of us know that right now. So once you understand the links and you need those things, I think it's really impossible to see how is it that you want to work on that. And once you're aware that the health sector is in many countries 10% of the GDP, it's 5, 7, even 10% of the emissions of the country. How is it that the sector is not going to work on this? And I have not heard of any system really that doesn't want to work on that. I have heard of many healthcare systems around the world that they don't know how to tackle it. That's different. It's like, it feels like too much, and how do we do it? So that's different. So we are working on them to solve that question really, and to work a very big network and community around the world that help each other really to tackle it. Because of course, no system can do this alone. And I understand that it can feel like too much.
Thank you very much, Antonella. I heard the awareness is a key, but also when we don't fix the problem yet, it comes back even bigger, and the cost of the problem comes back even bigger. And also the big challenge of implementation, the solutions that are there, but the answering the question of how.
And I have a minute, I can add just one example. Let's say in the south of Chile, it's a country just next to Argentina in South America, that has very important air pollution problems. So we had a system here in the south. I'm saying that here because it's close to where I live. It's like 5 hours drive of where I live. It's like already there. This is Valdivia in the south of Chile, in an area that has very important air pollution problems in winters, because Chile doesn't have gas and they have coal. So they use a lot of wood and they use coal still. And the hospital of the town, of the city of Valdivia, had a coal boiler just a few years ago. And in the city, the hospital, imagine in any small city, probably the most important hospital is the biggest building in that city, and it's the highest pollutant in the city because of those boilers and other things. So when that hospital learned that, they say, there's no way that we are a big polluter in the city. This cannot be. So I think the awareness really drives change, because you just didn't know. Once you know and you see that when you invest, you just make the health of your community better. How you need to be able to see those co-benefits. I think that we need probably a lot more research on that, on the co-benefits of the decarbonization, really. If you see those co-benefits clearly, I think there's really, why wouldn't you act, really?
Thank you very much. I hope that with this conversation today, we can raise awareness. Thank you very much for that. I see some questions coming in at the Slido. Please keep sending them. I have a second screen here and I see them. But maybe, Philip, I can raise one more question for you. With your experience on the landscapes of foundations and the related priority settings in Germany of foundations and beyond, could you give us an assessment, maybe, who is already in the field, who is investing, and who maybe needs to step up a little bit?
Yeah, that's a very good question. I think that's the same question that we are asking ourselves. But let me perhaps start with a more general remark with regard to the role of foundation. I think it's crucially important to understand that unabated climate change will erode the base of every philanthropic activity. As Larry Kramer, the president of UNIV, puts it, if we fail on climate, we fail on everything. Hence, I think it's a major task for philanthropy to integrate a climate perspective into the existing programs. So from my perspective, foundations should more reflect how climate impacts their topics of choice and integrate these into their series of change. Not just for the sake of climate change, but for the sake of the topics they are working on. So with regard to health, for example, that means if you are working on infectious diseases, on children's health, on the optimization of the health sector as such, to name a few, of course, it's very important to reflect how climate change affects these programs that you have and how you can have a co-benefit. So this is something, I guess, it's generally very important for philanthropy. With regard to health, I see there no real community of foundations at the nexus of health and climate change. A few foundations started to develop programs, but I guess most climate funders and health funders are within their silos. Therefore, I think it's really important to foster also a peer exchange between foundations. There is experience, there is knowledge, and no one has to start with zero. But yes, we are really, as a community, far away from systematically address the linkage of climate change and health. And what we do really to foster the discourse between climate funders and health funders is that we are cooperating, for example, with Daphne, European Foundation Network, with Active Philanthropy and the Philanthropy Coalition on Climate, really to strengthen this intersectional peer dialogue. Since, as I said, no one really has to start with zero, there is a lot of knowledge and experience in the field, but really have more foster this discourse, and we have to somehow build integrated programs as a community that address climate change and health and the interlinkages.
Thank you very much, Philip. I hear community building between and within foundations, and also if you want to tackle the intersection, you have to be the intersection. That's I think critical. Thank you very much. Sylvia, you and maybe Claudia as physicians, I have the question for you. Fears caused by climate change can have a lasting impact on mental health. Is a wave of patients rolling into the healthcare systems that no one is prepared for? So maybe we can talk a little bit on the mental health issues and climate change. Sylvia, would you like to start?
I can start. Maybe I can just share one story I think that illustrates it quite good, because I've been at a meeting of psychiatrists recently, and we've been talking exactly about this thing. And there's been one psychiatrist who's treating adults, and he was like, "Oh, my patients don't have this issue that much. Maybe they've been talking about the flood this year in Germany, but they don't have this nostalgia or this fear of what's going to happen with my environment." And then there was another psychiatrist treating children and teenagers, and he was like, "My picture is totally and completely different. Like, the majority of my patients really fear the future." So I would say, yes, there's a problem with this actually. And I mean, we already have this problem that we don't have enough mental health, places or possibilities to get treated. So yeah, if we don't act on it, and if we just keep it going as we do right now, not taking the actions that are needed, I think this will become a problem actually. Yeah. Claudia, maybe you can add on it if you want to.
Yeah, I absolutely agree. And I think it's not a problem that will come. I think it's present today. So I will cite a young medical doctor from the last climate change meeting in Berlin from the Helmholtz Society. And she was stating that she is not really afraid of that humanity is suiciding itself and about the result, but she really fears the way until humanity dies. And it was incredible, because she said, okay, I'm afraid of the wars. I'm afraid of the war concerning water, the wars concerning migration. So she didn't fear the death, but she feared the way until there. And I thought how pessimistic she was. And I think this is only a mirror of so many people, so many young people. And I think what you say, Sylvia, that especially the young people here are so fearing what is coming in the future, how insecure their future is. And the security we have at the moment, yes, we are struggling with the current pandemic, but at the end, we are really privileged here in Europe where we live. But this will change in the future. And I think the young people, they are feeling this. And I think it's a real tsunami which is hitting us quite soon concerning the psychosocial factors and the fear within the young people. So yes.
Yeah, and I think also multiplied by the COVID-19 pandemic and the effects of the public health measures on the so-called forgotten generation when we think of children and adolescents in the pandemic. So this is just the next layer and the next layer on top. Thank you very much. I will have a rather look at, maybe we can discuss a little bit and also continuing with you, Claudia, but please feel free, everyone else, to step in on communication and science communication. There's a question here in German, but I may translate. You are congratulated on your book, Claudia, but how can we bring the knowledge we have to the people out there, like to the general public? How can we communicate what we know to make people implement and move? I'm sure you can all talk about this, but maybe Claudia, because the book is mentioned, you can start.
Yeah, so this book is quite important, I think, but this is more really for medical doctors and people in the field. I wrote another book, which is this one. This is really for the general public. So here we described in a quite simple and nice language what climate change means for for us in Germany and in Europe. I think, and this is what we need. Actually, when I was asked whether I would like to write a book on climate change and health, I said, oh, sorry, I have no time for this because I'm medical doctor, I'm chief physician, I have an institute, so I have no time to communicate this. And this means, so I was lucky because I had Katja Trippel that helped me as journalist to write this book. But we have also to prioritize within our health system that we really prioritize also on communication. We have also to learn scientific communication. This is something which has also to go into our education. So I was not taught how I could or I have to communicate. So this is nothing what we educate to young medical doctors. So we have really to make this as a science to communicate in the right way that people understand us. So when people do not really understand what climate change means, it's also in a way our fault because we didn't tell them. So what we have to do is to tell people things in a way they understand it. The same with vaccination at the moment. So people do not vaccinate because they do not understand it. I had 1 hour talk today with a patient on vaccination, and I tried to explain it. And after this, he went up and said, no, I understood it. I will go now to vaccination. So the important thing is to speak with people on the same level, not here, I'm the doctor and you are, so really on the same level and to try to explain them. It's not their fault that they do not understand our strange language, our medical doctor language. It's not their fault because they didn't study it. So communication in the right way.
Thank you, Claudia. Antonella, I saw you nodding and also raising your hand. So please feel free to step in here.
Talking about the communications is that we're tackling that in 2 ways. Like we had the doctors and nurses and health professionals working on climate, really asking for training because they needed like to learn how to go and convince others and how to talk with the media and how to talk with their managers. And that was one thing. So we developed a leadership program on that so they could learn how to communicate why climate change was a health issue. And we are also working with the journalists because that's another thing, how the media covers climate change, right? So we're working a lot on that. First, it started in Latin America, but now Southeast Asia too, and we're trying to go global with that. We are conducting workshops and guidelines and working like with the journalists. So we have a very big group of journalists that understand why climate change is a health crisis and why to see the linkages. So a lot more people understand why is it? Because what we saw at the beginning is like, for example, the Lancet countdown reports, like only the health community working on that knew about it. But outside it, like I saw that with climate scientists in my country and Latin America, that they had no idea that the Lancet had that commission, had that report. So there's a lot of, I think, and once they know that, for example, in Argentina, what is going to happen, hopefully, is that the long-term strategy is going to have health as a transversal axis, and health is going to be there, and the health co-benefits is going to be everywhere. And that happened because we, as an organization, work with the Ministry of Environment and the climate scientists there to understand why climate was a health issue too. That they just didn't have the data. They don't read those papers. They read different like journals in a way. So I think there's a lot of us really, there's a lot of really that we can do still really to work on that.
But maybe we can dive even a little bit deeper in your experience here. What do you think from your way of working? What are the most common barriers and drivers you experienced for transformational change? How can we bring these communities together, and what are the barriers? And
with drivers, I think that when you understand that, as Claudia says, like you need to adapt because it is already here for many of the communities. And the pandemic, that happened. For example, in the Philippines, hospitals that we were working with, that they have like tents, like to have patients during COVID, and monsoon season came. So everything out. So you're very vulnerable in many countries. So you need to adapt. But on adaptation without mitigation, it's just not going to work. So that's why, like, the richer countries need to go faster. So we slow this really down. It's like we slow like the heating and the global warming, so we have less impacts, and we can allow the systems to adapt and to really think about a different model of care, a different model of communities. But if there's one, I think probably the drivers are probably awareness. When you see the links, you see that you need to act on that. And in the barriers, I do see, like, many times that they see that this is too much. How do we do it? And there are, like, hospitals that they change their boilers, they just change their waste management, and they change part of their procurement, but you're too small to change the system. And they are seeing and they are aware that we need to change the system. So that's where we need, probably that's part of the barrier, and what we need to work on is, and probably the driver to organize too. That's probably the driver. I'm going to join this network because I cannot do it alone. And you need to see that it is possible. So that's probably part of the barriers in the global south, at least. When we had all the examples were like from the Netherlands or the UK, like systems in the south that they say that, well, that's Europe, we cannot do that. And they reach Europe because there's other Europe, right? But it's like, so how to make it possible? What we do, at least, is to show really that it is possible and that we need that. And so part of my work is to show how in many places in the South, in developed countries, public healthcare systems that are far from rich systems are already doing this. So, and that the others need to join. So probably, yes, barriers is probably that it seems like too much. And it's not always a problem of finance, really. It's just how to, probably, where are your leverage points? It's like to identify those, what we need to do to really change the system. And because we don't have hundreds of years, that's probably part of the issue here, that we don't have decades, really, like, let's say with mercury, when we found out when it was toxic, and Minamata Convention just came into, like, I would say when they start just implementing, to be implemented just last year. So it's like, it was like, I don't know how many years, like 40, 50. We don't have those 50 years to, like, to slowly see how we learn. We need to go fast.
Yeah. Thank you. That fits to a question that came in. Can change happen without financial incentives? Are hospitals and other institutions aware of their responsibility? So I hear, yes, we can change without financial incentives. We just have to, I mean, there's no other option than to do it, right?
Yeah, I think if you see the co-benefits, I think we need to get a lot better in showing the co-benefits, because you will see that it is financially smart to change how you're doing things. And in many, many cases, you save money. Let's say with procurement, that there's a lot that we can do. We can go deeper, but let's say plastics, chemicals, climate change, waste. You can link all those together. And one of the things that we work is, for example, let's say the masks. Many are made from PVC and they are disposable. When you change to reusables, the reusable one costs, like, let's say 20 times more than the disposable one. But you can use it, I don't know, 300 times. So when you put that in your analysis, because if the procurement person only sees, well, this is a lot more expensive, so I'm not going to buy that one. But if you put a more, like, let's say, integral analysis, and you see the total cost of ownership of that, well, your results change. So how to address that? We work a lot. We work a lot with sustainable procurement. So to see those benefits when on change, so they can see that and they can change how they are spending money. And I think that's probably part of that, really, if we see the benefits. And of course, in some places, it's going to be more expensive, of course, because if you are the first one, the first mover, and that market is not that big enough, well, it's going to be more expensive. But again, if we see the long term, and we have a long-term vision, and we value innovation, we could start, shifting our mindsets, because we need that too. That's, of course, we need to change how we think.
Thank you very much. Just a quick reminder to our audience at home, please keep sending questions. I will try to pick them up whenever I think it fits in our discussion. Sylvia, maybe we can look a little bit into the future. Antonella talked about it, but also bringing a little bit back to the German sector and what is happening right now in Germany with the new coalition building. What do you think is needed from the upcoming new German government in terms of intersectoral cooperation? And what do we need concrete next steps, but also to make the work we are doing more successful and sustainable?
Yeah, okay. Thank you for this question. I'll go to this question like right in a second, but I just would like to add something to Antonella, because there are two important things. Like first, there's no other option than to act, because we don't have any other choice. Either we do something, or we, as Claudia said, we let humanity die. So there's nothing wrong we can do except that we do nothing. So I think that's the first premise. And the second one is, of course, we need politics and incentives, but we also need individuals. So I think we need both levels. You know, there's every individual needs to do something in their region, like on their own, of course, in their family, but also in their company, in their district where they're living. And of course, you can sometimes have this feeling of, okay, it's too much, but you need this also small actions to kind of not get rid of this feeling, but to get more hope. Because I mean, of course, there's been this nice paper from Courtney Howard from Canada, this emergency doctor, who wrote like, through action you generate hope, through action together with others you generate hope. So these are the true main principles I think we need, and we shall not or must not forget even. Yeah. And then to come back to your question, what do we need from German politics? First of all, I would like them to read, actually every parliamentarian, to read this new paper from the German Advisory Council on Global Change, which is like really, yeah, I think the key paper on why we need to talk about planetary health. And you just mentioned health in all policy, and then Philip mentioned climate in all policy. I would add, like, just let's combine these two and make planetary health in all policies out of it, so that there's a health impact assessment or an environmental impact assessment. I mean, if you do health impact, then environmental impact is included, like, by it on its, like, how do you say, but yeah, directly already in every decision we make on a political level. Because if we put health as a priority, yeah, there's like climate action and mitigation included already. So I think this must be the priority, and included, of course, on a more detailed level. This means, like, for example, phase out of coal. WHO already recommends it, but still we're like not working on it as fast as we would have to need it. Like, air pollution is still like the silent killer, as WHO calls it, and like so many people are dying due to air pollution or the effects by air pollution. But it also means we need to change our food system, like the way we feed ourselves now, or we grow food, destroys biodiversity, destroys habitats, and also is one of the major causes of these non-communicable diseases, which has like the biggest disease burden in our society. And also it causes harm by, for example, how you say, increasing antibiotic resistance. So these are, for example, two areas we need to work on, but also like change the way we live in cities, that we make it more pedestrian and bicycle friendly, and that we reduce, for example, cars in city, which are right now increasing air pollution and making this kind of inactive lifestyle more comfortable. So these are just three areas, but I think like the most important thing is really to put health as a priority, because then like we will tackle all these crises on the way with it.
Thank you. Yeah, and I think that
also the coalition agreement just got released, so after this discussion we can all have a look and how good they're implementing it.
Look and read and analyze. Thank you. And I think what you just said fits perfectly to what Antonella have said. We have to, as the health and climate community, talk and think more about the co-benefits and also about how to communicate them. Claudia, do you want to come in there? And maybe you can also let us know your thoughts on what has to change in research, in how we, and maybe Philip as well, as how we fund research in this sense. Claudia, would you like to start?
Yeah, let me start with the research, because I can go for commenting also what Sylvia said. But research, you are right. So we have to change the view of research, also the organization of research. And we know already that in environmental health sciences, it's a research where we have an inter or transdisciplinary approach. So it's not that only virologists or immunologists can work together, but we need really meteorologists, we need geographers, we need really this interdisciplinary approach when we try to understand how environment is impacting on our health and disease, and how these molecular mechanisms are. So here we need really to change this interdisciplinary view. And I give you a good example. So we just 2 years ago, we started a really interdisciplinary program within Helmholtz. So Helmholtz is the highest and the biggest, not the highest, the biggest non-university association of researchers. So people that are looking at the ocean, energy, everything. And we really put all these disciplines together. And it was really incredible how things moved forward with this approach. So your question was how we have to change research. And I say to you, we have really to foster interdisciplinary research. And this is also what we are doing now here in Augsburg. We formed a center of climate resilience. So here we are concentrating on climate resilience. And we also here bring together medical doctors, people from economy, from politicians. So we really try to bring everything together, because this is a grand challenge. And this is why we have also to do grand science.
Thank you very much. Philip, what needs to change in how we fund research? Can you maybe shed some light there?
Well, I guess what should be incentivized by funders is, of course, that you have not just classical research on the classical research, but you, of course, has very practical research. Since with regard to the trust and communication, what we really need is not just scientists to communicate about climate and health. It's also, of course, intermediaries that we need to translate scientific knowledge into public, into politics, and also to the practitioner level. So, like, for example, the German Allianz on climate change and health, we are happy to fund. It's a very important role to distribute scientific knowledge into the health sector. And of course, we need actors like a think tank, for example, who translate scientific knowledge into practical recommendations for politics. So, and of course, we need civil society to strengthen this regard and in their capacities to communicate on this intersection of climate change and health. So we need very much an ecosystem of actors at this nexus of climate change and health. And therefore, every investment, of course, in basic science should, of course, have this translation aspect in its basic strategy. And therefore, that is at the end what our next steps more generally, that we have to build really bridges between climate and health and to make really an integrated systems logic part of the DNA of institutions, foundations, NGOs, scientific organizations, of course. And there I see a role of foundations, for example, to strengthen such kind of organizations.
Thank you very much. I couldn't agree more. Claudia and maybe Sylvia, there's another question regarding I would call it imagination challenge and communication. I read it to you from Alina Winter. To what extent do you see a value in narrative presentation of future scenarios as a way to communicate the impact of climate change on health? So what kind of scenarios do we need to communicate? Claudia, would you like to start?
Yeah, I think this narrative of climate change impacting on our health is really a very fundamental narrative. However, when we always say climate change is killing us, this is not the right way to communicate, because it's too dramatic. They say, okay, you are exaggerating. It's not like this. And if I'm dying, I don't care because I'm dying anyway. So we have really to make it in a way that hope is the primary thing, which is at the end in the head of the people. So we have to say, okay, climate change is impacting on our health, but there is still room for action when we act now. And this is what the hope I have also personally. This is why I'm here. If I would think everything is lost, I wouldn't be here. I would look for private patients that I have more money today. But I'm here because there's still hope. So the narrative has to be, yes, it's impacting our health, but there is hope if we act now.
Sylvia, I'm putting you on the spot. Maybe you can share with us your future scenario, or what you think when we act now, where can we go?
So I have a favorite quote actually from Rutger Bregman, and I only have it in German, but I kind of try to freely translate it. He once wrote, and on the back of his book, the bad thing is that not that we are not feeling good, but that we can't imagine that we feel even better than right now. And I think that's the thing. And I just totally agree with what Claudia said. We can create, for example, I mean, I live in a city. I live in Berlin, so I'm talking about cities. And also in Germany, the majority of people are living in cities. But I believe that we can create cities where people are even healthier, that where we can walk, where we can have parks and trees, where we can get in contact with other people and tackle all these problems of like not moving, about feeling lonely, feeling stressed, having air pollution. I think that we can create a habitat, or I don't know, a city where we can improve all these conditions and at the same time kind of co-live with our environment again together.
Thank you very much. We have about 20 minutes now, and I would like to invite the four of you to help me with my moderation for the next panel by being very concrete and letting me know what your ideas are on advising political policymakers for the next session. So what advice would you give policymakers when it comes to climate change and health? What are your priorities? What should come first and second and third, maybe? And maybe we can just discuss it here, and then I can put something on my white piece of paper and then discuss with the policymakers in the next step. Who would like to start? Antonella?
Okay. Advice.
Imagine you stand in the German Bundestag in our parliament building talking to policymakers. What would you say?
Yeah, I'm not an expert on Germany, so let me be here. Maybe I'll say something that you're already doing, but I would say Germany is a leader worldwide, leader in the G20, leader in the EU, leader, and should lead on this too. At least personally, I'm not seeing that. Germany leading on climate and health, on this deep understanding that we are not going to achieve the SDGs, we are not going to achieve zero poverty, we are not going to be able to close the gender gaps, we're not going to be able to really to do a lot if we don't solve climate change. That needs to be clear, and that would probably put the priorities. Like, if we don't solve this, anything else is impossible to achieve, that we have internationally agreed. And there's an historical responsibility and actual responsibility of the richer countries and the developed countries to help the countries in the south to be able to cope with this, to be able to adapt, as Claudia was saying, that Europe also has to adapt, but countries in the south need to be able to adapt. And we need to mitigate so that adaptation is effective, because if we only put some money, let's say, on adaptation, but we don't mitigate fast enough, as we have to, and as the IPCC is telling us over and over, it's just not going to work, because the problem is going to get bigger and bigger and just impossible really to solve. And we will have many millions of climate migrants around the world. And so it's going to be really an awful thing to look at. So for it to set the priorities is, yeah, it's like, well, like do what you have to. I think we all know that we have to. We just need to take the courage and say, okay, we're doing this, and shift direction.
Yeah. Thank you very much. And listening to this, Claudia, I come to you. What are your 2-3 advices to the German government, and knowing the German context maybe a little bit better than Antonella, but using the spirit from Antonella? What would you advise?
So I would take everything what Antonella said, plus I think the focus really has to be on prevention. So the health system has to go for prevention, because we have to understand that prevention is the best and cheapest therapy at the end. And this is why in the healthcare system we have to focus on prevention. Also, the current pandemic shows us that the healthy population is a guarantee for pandemic management. And this is why we have to concentrate on prevention, because also with heat, the vulnerable people are dying, which means the adipose people, the diseased patients, they are dying. And this is why prevention is the thing we have to focus on.
Thank you very much. Philip, would you like to share your advices?
Yeah, thank you. Yeah, generally, talking about cross-cutting challenge the whole day, it would be perhaps surprising if I would come back to this. So I would say that the next government has to make sure that climate is integrated in all major policy areas. In health, of course, we're talking about this, but also in economic policies, finance, very important, housing, urban planning, transport, agriculture. So this really have to be this cross-cutting thinking with regard to climate change, and not to put it in somehow in the environmental corner, but really get it into the corner of politics. As we said, climate in all politics, as we heard today, how the new government will be constructed, like it looks like at least this time it will be very much connected to economy, but of course it has to be also be a focus area of all other major topics. So this is really important, and then with special regard to the health system, we really have to integrate climate change and sustainability into the structures and to the goals of the health system. Now we're talking about access, we're talking about quality, we're talking about cost, but I guess that sustainability has to be really additional and equally important goal of the whole system, since if we won't have this, we risk that with regard to all the challenges that the system has, pandemic, like costs, like digitalization and so on, we risk that climate change is some kind of a side topic, but it needs really to be in the core of health policies. Also, to really combat the other challenges. As Claudia said, prevention is much easier than adaptation at the end, and it's much more, and it's much less expensive. Therefore, this is really something that need to be achieved very soon to really put climate change into the structures of the health system.
Yeah, thank you very much. Sylvia, you already mentioned we need planetary health in all policies, but maybe you have even more advices you want to share.
Yeah, of course. I can agree with all the people speaking before me. And to be concrete, I would say like phase out coal until 2030. Right now it's like too late, 2038. So we need to phase out way earlier. We need to adapt our air quality measures to the ones from the WHO, and therefore, I mean, of course, it's European level where we also decide on this value guideline values. So we need to, as Germany, also work that the European Union is changing their values, because right now they are fourfold the value, for example, for particulate matter compared to the value that the WHO recommends. So 5 versus 20 microgram per cubic meter. And then we also need to, of course, as I said, like change the nutrition and change the nutritional guidelines, because the agricultural sector is taking or producing up to 1/4 of the emissions, and we need to promote the planetary health diet. That's the diet we haven't been talking about so far. That's a diet which is good for the planet as well as good for the people. And yeah, I think we should promote these more, and these would be my 3. And the 4th one, as a doctor, of course, I have to say, we need a plan, an action plan on how the German healthcare sector can become climate neutral. So far, the NHS, so the National Health Service from the United Kingdom, has one, and they agreed on the aim to become climate neutral until 2040. We don't have anything similar in Germany. So, of course, we need this own will of people in the healthcare sector to change something, but we also need political incentives and the political commitment to act upon this. So, these are my 4 wishes for the panel discussion. And
thank you very much, Sylvia. And I think this is perfectly coming back to Antonella's keynote when we talked about why didn't Germany sign the net zero commitment. Antonella, do you see? It's perfect. Thank you very much, Sylvia. You made like a very nice ending for the session. But maybe Antonella, I give you the very last word. What do you think are we on a good pathway here when you talk to German stakeholders as we did today? What do you get the dynamic and the energy, or is it just me?
No, I get it. I think that we are all like gathering together or going in that same direction. So I really hope the next panel joins the movement and they say, okay, we're going to do it. And by December, we know that the healthcare sector in Germany is going to net zero in 2050, and they are starting to create the roadmap. So that will be really good. And probably this is where we linked that with the co-benefits, with the adaptation, with how that is going to drive changes in the food system, how that's going to drive changes in many other systems. Because for the health sector to get to net zero, there's a lot that needs to change, that it's way outside the health sector. And that's why Philip was saying that you need that the climate in all policies, as we need health in all policies, in all climate policies, for example. Because just when you see the sector and when you see its emissions, you're going to see that if you see the fact sheet that we created for Germany in the roadmap, you're going to see that how those emissions are really, where are they? And part are in the food system, part are in the supply and how the pharma are produced. Part is on how your employees commute to work, and part is on your boilers, your ambulances. It has so many things that the sector needs all the other ministries to go in the same direction to be able to get there. You cannot do it alone. So I think that's probably a very good thing to talk about in the following months.
Yeah, thank you very much to show us all the facets of what we have to think about when we talk about reducing emissions. And I think this is some kind of a new lens to the health community. So it's not only treating patients or providing a program in a low middle income country, it's also about the supply chain and how we get there, and if we are and how cities are planned. So it's way more than that, which is basically a public health approach or a global planetary health approach to everything. Thank you very much for providing these insights. We're a bit early, which is unusual because usually we're always over time, but I'm happy about that. Thank you very much for helping me create a long list of advices I will use in the next panel. Thank you very much for being here and sharing all your experiences and thoughts. There's like coming, not a question, but a congratulation. Thank you for this very fruitful debate comment on the platform. Thank you very much for the audience for sending in the questions. I think that was very fruitful as well. And I now send you in a 10-minute break, and we see each other again at 3:30. Thank you very much.